Welcome to the deep dive. Today, we're really getting into something serious. Smoke inhalation in animals.
Yeah, it's a tough one. We've got these clinical guides, the real deal stuff vets use when treating pets from fire.
Right, and our job is to pull out the absolute essentials for you.
Exactly. We want you to understand how smoke actually, injures animals, not just irritates them.
Why it's so dangerous, both right away and later on.
Mm.
What signs to look for.
Whether you're in the vet field or you're a pet owner, these signs are crucial.
And how vets figure out what's going on and treat it.
We're digging out those surprising details and core facts so you can get up to speed quickly on this. It's vital stuff.
Okay, so let's unpack this. Smoke inhalation. It's not just one thing, is it? The guides are really clear.
Not at all. It's like a multi-pronged attack. The sources talk about 4 main ways smoke damages the body.
4, okay.
Yeah, and knowing these really helps understand how serious it is. First up is a mix of low oxygen and actual poisons.
Poisons, like what?
Well, the big one is carbon monoxide, CO, colorless, odorless, comes from stuff not burning completely.
We all know CO is bad news, but what's the specific danger here?
Okay, so here's what the guides really hammer home. It's affinity for hemoglobin. You know, the oxygen carrier in blood?
Yeah.
CO likes it 200 to 250 times more than oxygen does.
Whoa. So it just muscles oxygen out of the way.
Pretty much. It latches on, forms this carboxyhemoglobin, COHB. And here's the really sneaky part. The source is stress. Your standard pulse oximeter. It can't tell the difference between hemoglobin carrying oxygen and hemoglobin carrying CO.
Oh, no.
Yeah, so you get this falsely normal oxygen reading while the animal's tissues are actually suffocating.
So the blood looks full, but it's full of the wrong thing. Tissues aren't getting the oxygen.
Precise. Widespread tissue hypoxia, and then, less common but really lethal, is cyanide.
Where does that come from?
Burning plastics, wool, silk, things like that. And cyanide works differently. It stops the cells from being able to use the oxygen that gets delivered.
So the oxygen arrives, but the cells can't unlock the door to use it.
You got it. Histotoxic hypoxia. Brutal.
Okay, so that's the chemical attack. What's number 2?
Direct heat damage, thermal injury, and maybe surprisingly, the guides say this mostly hits the upper airways.
The nose, throat, windpipe?
Exactly.
Yeah.
Nasal passages, pharynx, larynx, trachea. They act as pretty good heat exchangers normally.
Kind of like a built-in radiator?
For dry heat, yeah, largely. It cools the hot air down before it reaches the deep lungs.
But there's an exception.
Steam. Superheated steam carries way more heat energy and can cause severe burns much deeper down.
Okay.
But even just in the upper airways, that heat causes swelling, edema, inflammation, damage to the lining. It paralyzes those little cleaning hairs, the cilia.
Which can block the airway, right?
Fast. That swelling is a major, major concern.
Right.
Then mechanism 3 is chemical irritation.
Like acids forming inside.
Basically, yeah.
Yeah.
Smoke's got nasty stuff. Aldehydes, sulfur dioxide. When they mix with the moisture in the airways, they form acids and alkalis. Corrosive stuff. And the sources say this happens in 2 waves. First, an acute phase.
Right way.
Minutes to hours. You get bronchospasm, the airways clamp down lots of mucus, direct cell damage, tracheitis, bronchitis.
And the second wave.
This is the one you really have to watch for. Hours to days later, the damaged airway lining can just slough off.
Oh, wow.
More swelling, more inflammation. And that system for clearing out mucus, it gets totally messed up.
Meeting 2.
Huge risk of secondary bacterial pneumonia. And ARDS, acute respiratory distress syndrome. That delayed reaction is a critical takeaway.
That really changes things. It's not just about the fire itself.
Not at all. And the last one, number 4, is particulate matter.
Soot particles.
Yep. Tiny bits of soot and other gunk breathe deep into the lungs.
What do they do down there?
They irritate, cause inflammation, physically block the small airways, mess with gas exchange, and they act like little landing pads for bacteria.
Increasing infection risk again?
Exactly. So you've got poisons, heat, chemical burns, and physical gunk all hitting at once.
It's a massive assault.
Yeah.
So with all that going on, how does it actually look? What signs would you see in an animal?
Well, this is where it gets complicated. The guides really stress signs can show up right away, OR. They can be delayed.
How delayed?
Up to 24, 48, even 72 hours later. And the signs you see depend on which injury mechanism is worst for that animal.
So a pet could seem okay leaving a fire scene, but still be in serious trouble.
Absolutely. That's probably the single most important message for owners, rescuers, everyone. Monitor, monitor, monitor.
Okay, so common signs, respiratory ones first.
Yeah, that's usually front and center. Coughing may be harsh, maybe dry, difficulty breathing, dyspnea.
Can you tell where the breathing trouble is?
Sometimes. The guides mention clues, like if it's noisy or hard mainly breathing in, that points towards the upper airway swelling up.
Larynx, pharynx area.
Right. If it's more effort breathing out, that might be lower down bronchospasm, tight airways.
What else visually?
Soot around the nose or mouth. Singed whiskers or fur, maybe actual burns on the lips or nose, breathing really fast and shallow tachypnea.
And listening to the chest.
You might hear wheezes from tight airways or crackles if there's fluid or inflammation.
Or nothing.
Or scarily, very quiet or absent sounds if air just isn't moving well. And cyanosis blue gums. That's a late, really bad sign. It means severe lack of oxygen.
Okay, beyond breathing. Any other systems affected?
Neurological signs are a huge red flag. They strongly suggest CO or maybe cyanide poisoning.
Like what?
Lethargy, weakness, acting confused, unsteady, even seizures or coma.
Anything else neuro-related?
Well, something fascinating the sources mention. Humans with CO poisoning can get these bright cherry red gums or lips.
Oh, yeah, I've heard of that.
But the guides are clear. That sign is rarely seen in vet patients, so don't count on seeing it.
Good to know. Don't wait for the cherry red sign. What about eyes?
Very common to see eye irritation. Damage to the cornea, ulcers, lots of blinking or squinting, red conjunctiva. Sometimes they'll even pot their face because it's so irritated.
Makes sense. And skin.
Obvious burns, of course. But even just finding soot in the fur or seeing singed hair tells you they were exposed.
Any other systemic signs? Less common ones.
Yeah, less common initially maybe, but things like vomiting, diarrhea, a fever could pop up, especially if infection sets in, low blood pressure, shock, even heart rhythm problems from the low oxygen or toxins.
Okay, so you've got an animal maybe showing some signs, maybe looking okay, but exposed. How does the vet team figure out the real damage inside? What's the diagnostic plan?
It has to be fast and thorough. Starts with the basics, the ABCs. Airway, breathing, circulation.
Oxygen first.
Always. Get oxygen on board immediately. Check their consciousness level. And remember what we said about pulse oximeters for CO.
Right, they're misleading.
So you rely on the physical exam. Breathing rate, effort, listening to the chest, looking at membrane color with that CO caveat, checking pulse quality.
Then labs.
Essential. And arterial blood gas ABG. That gives you the actual oxygen and CO2 levels in arterial blood, plus the pH.
And then that can show problems even if the pulse ox looks okay.
Exactly. With CO poisoning, the amount of oxygen dissolved in the blood, the PaO2, might look normal, but the tissues aren't getting it, so they switch to anaerobic metabolism.
Creating acid.
Right, which shows up as metabolic acidosis on the ABG. That's a big clue.
Okay. What else?
For CO, the gold standard test, the sources emphasize this, is co-oximetry.
Co-oximetry.
Yeah, it's a specific machine that actually measures the different types of hemoglobin, including the COHB, the one bound to carbon monoxide.
So it tells you exactly how much hemoglobin is tied up.
Precisely. It's the only way to accurately quantify CO poisoning. If you suspect TO, you need this test.
Gotcha. Not just a standard blood panel.
Right. Another key lab is lactate. High lactate means tissues aren't getting enough oxygen, they're struggling. Very common with CO, cyanide, or shock.
Other blood work.
Yeah, a CBC, a chemistry panel. These look for signs of stress, inflammation, potential organ damage. The guides mention that finding really low white cells or platelets can be a bad sign prognostically.
And cyanide levels.
Usually take too long to come back to be useful in the immediate emergency.
Okay, what about seeing inside? Imaging. X-rays.
Chest X-rays are standard, definitely. But here's a really important point from the sources.
Yeah.
They're often completely normal at first.
Really? For how long?
Maybe the first 24, even 48 hours. The changes, the edema, the inflammation, they take time to show up on film.
Wow.
Later, you might see patterns of bronchitis or pneumonia or ARDS, but, and this is also key, the severity on the X-ray doesn't always match how the animal is actually doing or how they'll do.
So a scary X-ray doesn't automatically mean a poor outcome.
Or a normal one doesn't mean they're out of the woods.
Yeah.
It's just one tool.
So how do you get a better look at the airways?
Direct visualization. The sources talk about laryngoscopy using a scope to look at the larynx, the voice box area.
Why is that so important?
Because swelling there can happen fast and totally block the airway. You need to see it. And then bronchoscopy lets the vet look deeper into the bronchi.
What can they see there?
Soot, mucus buildup, inflammation, damage. and they can take samples. A bronchoalveolar lavage, or BAL, washes a small area and collects the fluid to check for infection.
Sounds crucial for guiding treatment. Okay, let's talk treatment. You've assessed the damage. What's the game plan?
It's got to be aggressive, and it often takes time, days, the guides say. Starts with stabilizing them, back to ABCs.
Oxygen, oxygen, oxygen.
Absolutely number one. 100% oxygen. Mask, oxygen cage, nasal cannula, whatever allows high concentration.
And that helps with CO specifically, right?
Yes, 100% O2 helps knock the CO molecules off the hemoglobin, basically cutting the time it takes to eliminate CO in half.
Okay. And that dangerous upper airway swelling.
Monitor constantly. The guides really push for early intubation. Get that breathing tube in before the airway swells completely shut. It can be life-saving.
What if it's too swollen even for a tube?
Sometimes a temporary tracheostomy, a surgical opening into the windpipe, is needed.
Okay. Fluids?
Careful 4V fluids, yes. Support circulation, but you have to be really cautious not to overload them, especially the lungs. Too much fluid can make pulmonary edema worse.
Unless they have skin burns.
Right. Animals with significant skin burns often need more fluids. And pain relief is important too. Opioids, often, for burn pain or just the work of breathing.
Are there specific antidotes for the poisons beyond oxygen?
For CO, high flow oxygen is the main thing. Hyperbaric oxygen therapy, HBOT, pressurized oxygen is technically the best because it works even faster.
Right.
But it's very rarely available in vet hospitals. For cyanide, if you suspect it, the drug of choice is hydroxycobalamin.
Which is?
A form of vitamin B12, actually. It binds to the cyanide so the body can get rid of it safely. Sodium thiosulfate is another option mentioned.
What about helping them breathe easier if the airways are tight?
Bronchodilators can help, yeah. Especially helpful in cats sometimes. Drugs like terbutaline or nebulized albuterol. But use them carefully. The source is warned. They can have side effects like rapid heart rate.
Okay. Steroids. For inflammation.
This is a really important point the guides make. Steroids are controversial here. Meaning they're generally not recommended for routine use in smoke inhalation.
Why not?
Risk of infection, delayed healing, a very short course might be considered for really severe swelling in the larynx or life-threatening bronchospasm that isn't responding to anything else, but definitely not standard practice.
That's interesting. Different from some other breathing issues.
It is a key distinction. Other things that are often helpful, mucolytics,
like
nebulized and acetylcysteine, NAC, helps break up thick, sticky mucus.
Makes it easier to clear.
Exactly. And combining nebulization just with saline to hydrate things with coupage, gently tapping on the chest wall, helps loosen secretions physically.
Okay. Antibiotics. Give them just in case.
Nope. Not preventatively, only if you have actual evidence of bacterial pneumonia developing.
Like a fever, worsening signs.
Yeah, or changes on follow-up x-rays, or you get bacteria back from that BAL sample. Otherwise, you wait.
Diuretics. Water pills.
Only if you have confirmed fluid overload in the lungs, pulmonary edema that isn't getting better with just being careful with IV fluids. Or maybe if the pet had pre-existing heart failure.
And just general TLC.
Totally essential. Nutrition is huge for healing. Might need a feeding tube if they won't eat. Eye drops or ointments for corneal injuries. Wound care for burns. Meds to protect the stomach, keeping them warm. It's intensive care.
It sounds incredibly intensive. So after all that, what's the outlook? Prognosis? Long-term issues?
It's really variable. Depends heavily on how bad the exposure was, if they had neurological signs, how bad the burns are, and crucially, how quickly treatment started.
More of a bad signs.
Severe neurological problems, really high CO levels on that co-oximetry, large skin burns. Those usually mean a guarded to poor prognosis, and any delay in treatment makes things worse.
And even if they pull through the initial crisis, are they totally back to normal?
Not always, unfortunately. The sources list potential long-term problems.
Such as?
Chronic bronchitis, meaning a persistent cough. Pulmonary fibrosis scarring that makes the lungs stiff. Recurrent pneumonia because their airway cleaning mechanisms might be permanently damaged.
Wow.
Laryngeal stenosis, narrowing of the voice box from severe heat damage. Lasting neurological issues from brain damage due to lack of oxygen from a CO. Even an asthma-like syndrome where the airways stay hypersensitive.
So recovery isn't just getting out of the hospital.
It can definitely be a marathon, not a sprint.
Okay, so wrapping this all up, what does this deep dive into the clinical guides mean for you, the listener? How do we connect this to the bigger picture?
I think the single most critical point, especially for owners or anyone first on scene, is that potential for delayed signs.
Up to 72 hours.
Right. An animal can look fine, walk out of there seemingly okay, and then crash 2 days later. Any exposure means they need veterinary evaluation and close monitoring, period.
And for those caring for these animals afterwards.
Understanding that recovery can be really long and slow. It might take weeks, even months of continued care, medications, vet checkups. Managing expectations is key.
The sources also touch on prevention, right?
Briefly, yeah. Things like having fire safety plans that include your pets and making sure vet clinics are ready to handle these emergencies.
It's really clear from these guides just how incredibly complex smoke inhalation is. It's not simple irritation.
No, it's a cascade of serious injuries, the poisons, the heat, the chemicals, the particles. Understanding that helps appreciate why treatment is so involved.
And why those subtle or delayed signs are so critical to catch. The diagnostics, the treatment nuances like with steroids, it's a lot.
And it really underscores why getting help fast is so important, even if the animal doesn't seem critical right at that moment.
Which brings up a really important question, I think. Knowing about these hidden injuries, like the CO hijacking hemoglobin or the chemical burns developing days later, how does understanding those mechanisms deep down change our perspective on the real urgency and the long-term commitment needed? Even when the flames are out, the internal battle might just be starting.
That's a powerful thought. It reframes the whole timeline.
Definitely something to think about. Thank you for joining us for this deep dive into the source material.